Dr. Maksym, thank you for accept our interview. First, we want to know the core theory of Gensingen brace, how you check the patients, and what you design the brace.
Right. First of all, thank you for your kind invitation. Gensingen brace has a long history. This is a result of the third generation, from Katharina Schroth to Leonard Schroth and to Dr. Weiss. This is more than 90 years of history. We designed this brace according to the augmented Schroth classification, and the main thing is to mirror deformity and correct the body and the spine in 3D. So in that case, you can see this X-ray. This is 3CH model, and you can see curve to the right side, and the body usually decompensated to the left side, to the right side as well. And in brace, you can see mirroring effect. So the body and the curve decompensate to the opposite side. And when we achieve this result, we can see in brace correction is pretty straight, and the intermediate result you can see after 6 months. So this is intermediate. This is not end result. This is intermediate result. So we're still working with her. Another thing, when we're talking about 3D correction, you can see the difference between these two pictures. This is initial pictures. You can see the big rib hump, and intermediate result is pretty the same.
So we also want to know about the treatment target of Gensingen brace and its main principle.
Brace indication is between 20 and 45 degrees. But at the moment we have some cases, and we published a paper about this. We achieved good results with patients with curve exceeding 50 degrees.
So what do you think when compared with traditional braces, and what is the advantage of Gensingen brace?
Gensingen brace is the latest development of chenal brace. The most of brace, what we can see in China, is very big, and most of the time symmetrical braces. You can see, and sometimes for the short curves, brace is very big. Gensingen brace at the moment smaller, more comfortable, and more corrective according to the international literature. And we use a 3D point system. If we press, we need free space. We press in 3D, so we have, if we press from this plane, we have free space here. We have good sagittal plane, and we have the rotation effect. If we press on this, we need free space here. Thank you.
Next, except Gensingen brace, we also have Schroth exercises. So during the development of Schroth exercises, which group you focus on?
With Schroth exercises, I want you to say that Gensingen brace is a Schroth compatible brace. The same philosophy in Gensingen brace and in Schroth exercises. And for Schroth exercises, we start with a curve about 15 degrees with children, and we use new Schroth best practice program. But for the patients exceeding 70 degrees, we use old Schroth technique.
So what's the main aim of Schroth exercises, and what benefits, patients will benefit from exercises?
The main aim of Schroth exercises and the main aim of our program is to teach the patients how to keep corrective posture during the daily activity, how to avoid bad posture, and how to achieve good results with cosmetic appearance and how increase the vital capacity and how to breathe correctly.
Thank you. And next one is about this gassing breaths and blood exercises. This is all called conservative treatment. So for scoliosis patients, what is the significance for them?
First of all, the very big problem in China that many patients have no any information about conservative treatment, and they still progress. The good thing, when we start with not huge deformity, we can achieve better results. So the main benefits for patients is avoid surgery and have a good cosmetic appearance of the body.
What do you think is a future tendency of
future tendency about the bracing, of course, is 3D printing bracing. It's very interesting, and in China we have printed first brace in 2015, and it was first corrective scoliosis 3D printed brace in the world. So Gensingen brace is, I can say, first corrective brace in the world which printed in 3D, which 3D printed. And at the moment we have only 3 questions: is time of printing, is cost of printing, and still questionable materials. But I hope in the near future we will have answers and we will print more.
Okay, thank you very much.
Thank you.